my presentation, I will give a short overview about the current state, but most importantly, I pick out some proteomic studies that have been performed, which I think can be very useful for the headache community. I would say, in general, biomarker studies can be used to the identification and verification of diagnosis. But you can imagine that for headache syndromes, we have already our ICHD-3 classification. So in clinical practice, I don't need a biomarker to diagnose a migraine patient. So I think biomarker studies are not that interesting for the diagnosis of headache disorders, but they are important, for instance, to predict disease progression. So for instance, if we have a biomarker that can predict whether a patient is more prone to develop chronic migraine, so more severe migraine, it will be very helpful. Most importantly also, when you start treatment in patients, it would be very helpful if you have a marker that could predict response. For instance, if you provide very expensive new treatments, it would be extremely helpful if you could predict these patients will likely to have a 50% chance of developing 50% reduction of migraine days. So I think in that way, biomarkers can be helpful in clinical practice as well. And thirdly, I think biomarkers are extremely important to identify new pathophysiological mechanisms for headache disorders like migraine. And with this, they can be helpful to develop new treatment strategies for our patients, because we have a new area and a new treatment developments, but still there are many patients who do not respond also to these new treatments, like for instance the anti-CGRP medication. So there's still huge need of both migraine patients, but also for other headache disorders, to identify pathways in which we can be able to interrupt these pathways and to help our patients. And I think that's for me, it's the most important thing of biomarker studies and proteomics and metabolomics studies.